Hi, my name is KAldridge, and this is my research proposal poster. So, the general problem of practice when I started this research study was oral language development. Oral language development is a major focus in the early elementary from preschool, kindergarten, even up into the first grade. Um, for elementary students, we're seeing a lot of lack in oral language. I know, especially in my school and from my classroom as well. So, the title of this research poster is The Power of Words Strategies to Support Oral Language and Vocabulary Development in Early Learners. So, to begin, introducing really what the main overview of the study would be is, of course, the development of oral language in early elementary students that range from pre-K to um, no later than first grade. Both oral language and vocabulary have an impact on students' reading and writing abilities. In an article, A Systematic Review of Teacher Language Practices and Child Oral Language Outcomes in Early Childhood Classroom, the author discusses that oral language is widely considered to be one of the critical components of reading success and growing awareness of the important role of oral language development in early childhood. The problem of students' lack of oral language and the struggle of their oral language is recognized by educators. So, the problem statement for this study is the importance of oral language and vocabulary development is being recognized. Although there is research to support how it can help students with learning and social interactions, there are limited evidence based interventions and studies that can support students' oral language and development. So, while I was doing research in trying to find how to help these students, there was little interventions, definitely evidence based interventions to support the growth of oral language and vocabulary support for these early elementary students. So, the research question following the study is how can targeting the development of oral language and vocabulary skills influence early elementary students, and what practices can be implemented to effectively support this growth? So, really looking for those evidence based practices so that teachers aren't having to trial and error with practices and interventions, trying to figure out which one would be best and show the progression that they needed for their students. So for the literature review, there was two main studies that was focused that discuss students' oral language and vocabulary development and their impacts on students' reading skills and learning abilities overall. That first study is the Australian Early Childhood Teachers Training in Language and Literacy. A nationwide review of pre-service course content includes the development of oral language and vocabulary and their impact on academic success in school. So this study, it was very difficult to find studies within the U.S., but Australia conducted this study, seeing a trend in their students lacking oral language and the literacy skills that were needed. Realized that the teachers that they were putting out into schools to teach these kids within themselves did not have an understanding of oral language and how to support those students, and through um, more teaching and learning and understanding of oral language and interventions to show how it did support students in the end after educating these teachers. And then the second study, elementary teachers intervention fidelity in relation to reading and vocabulary outcomes for students at risk for reading related disabilities, focuses on students' ability to read and the use of targeting reading instruction and the use of interventions for reading and oral language outcomes. So, what were some interventions and things that were used, what were targeted in this study were a few things that were changing the curriculum and looking at how that really targeted not just students overall, but those students with disabilities, those students that really had those struggles with oral language and vocabulary development. So, the theoretical framework for this study is the framework following the study follows more of the social-cultural theory. The framework really focuses on the role of social interaction and cultural tools in learning. In an article that discusses the sociocultural theory, the author, Scott, includes that the focus of the sociocultural perspective is on the roles that participation in social interactions and culturally organized activities play in influencing psychological development. With the use of these frameworks, students' language and development are able to be observed in order to understand their growth. So when we're observing an oral language development, as well, there could be some statistical data, but we're going to see the most understanding and growth for the interventions used in using that more hands-on observation approach, seeing how students interact with other students after having these interventions, seeing how they interact within the classroom, seeing how that language development begins to grow in more of an observation type setting rather than a formal assessment. And then the methodology, a qualitative study that involves observations of students' interactions in explicit vocabulary instruction and the growth of language. Analyzing the data provides understanding that with exposure and understanding of words, student language can be better supported through read alouds, interactions, and explicit learning. So really focusing again on the observations, what we're seeing, how our teachers, relaying the feedback of their students, what are they seeing of their students after they're going through these interventions multiple times a week to support that vocabulary instruction and language growth. So really more focusing on the what is happening, how is it being effective, rather than the data of a formal assessment of answering questions or listening to a reader and then answering those questions. And then the ethical considerations. Some ethical considerations of the study are consent, confidentiality, and data protection. All those are very important when conducting a study. One way to ensure the protection of these participants is to obtain consent forms by informing them of the study with using studies within education, not only consent forms for the teachers and the schools, but also for the students and the families, making sure that those participants understand what the study's for and how the data will be used, making sure you're having that signed consent so that parents are understanding what's going on in the classroom and how that this study that's being taken will also continue maybe to help those in the future as well. Having participants sign these consent forms is the best way to ensure their protection. Keeping participants in schools anonymous will ensure that confidentiality, not using names, discussing leaving school names out of it, even maybe geographically close to where the school is, like in the Australia study, they just tell you that the school is based in Australia, that the study is based in Australia, and then it's based in an elementary school, multiple elementary schools to be exact. So it doesn't tell you exactly where or when it really kind of took place to ensure that confidentiality of the participants within the study. And the data protection can be ensured by using consent forms and only collecting the data needed for the study. So only presenting the data that was needed for the study within the study, not including any of the extra data that may have been seen or collected, only really focusing on what data is relevant to the study. The timeline for the study would be over about a 6-month progression, beginning with planning and preparing to design of the study, especially within the first month, maybe 2, and then research and obtaining consent forms and participants would kind of take place following into month 2. That finding the right fit schools and participants can take a little bit more time than it being a very quick and easy tasks to do. Sometimes that could take a little bit longer, making sure you're having schools that really fit into the study and that the participants, the students, are within that language deficit. So they are the students that are the right fit for the study. And then over the next 8 weeks, collecting data and observations within the classroom and from students, really taking that time to spend time in the classroom in the beginning and in the end to kind of see how that it maybe have grow how their growth has shown, and also kind of those conversations with teachers over the 2 month period. So hitting in within the last 2 months of this study, analyzing and interpreting the data recorded can definitely take some time, and with the last weeks to finalize the report and finish up the study overall. It can take a little bit more time, but I do believe that the 6 month timeline provides time for the study. It could pertain over a year to give the observations and students more time for growth. And overall, this is my research proposal poster. Thank you.